Hello, I'm Sarah and welcome to our training day today. So you've come to do a bit of Botox training, which is fabulous. I will give you a bit of an introduction about myself and a bit of my background. So my name's Sarah, I am a nurse. I've been a nurse for about 5 years now. I primarily worked in the intensive care unit at the hospitals for about 5 years, and I left in March 2021 to pursue my career in aesthetics. It's been going great. It's my absolute passion to do aesthetics and also to now be able to train people to do the same so that they can be safe and efficient practitioners. So yeah, I'm absolutely loving it, and I hope that you love the training as much as I do.
Oh, thank you.
So yeah, what about you?
Well, my name's John. I was an engineer, and I had an accident and brought me back. I had to stop doing that for a reason or other. But I noticed when I was having all my operations on my back and my knee, how people were talk about this Botox, how it increases your face and your face doesn't drop, your eyebrows lift and all that. And I thought, well, I can't do what I did do for a living anymore, so I was going to get bored stiff at home. Yeah. So I thought I might as well try and do this.
Absolutely.
And I heard about it. I've seen your work. Yeah. I've seen your adverts, and I thought, well, might as well go for this diamond skincare.
Oh, brilliant! Yeah, fabulous. Well, I hope that you get as much out of this training day as you can. Okay. Just to go through a few little bits of ground rules and a bit of housekeeping and everything. So we'll always have mutual respect for each other, whether it be on a one-to-one session or within a group. Phones, I just ask them to either be on silent or turned off, whichever you prefer. If you do have a call that you're expecting or anything, completely understand. If you do need to keep it on loud, just let me know before we start. So I always say no question is a silly question. If you've got any questions throughout, please just ask it. You know, I don't want you to go home and be worrying, thinking, I wish I'd have asked that question, and, you know, you're a bit unsure of anything. So the fire exit's just through the front door. The toilet facilities are upstairs to your left. And yeah, again, please just ask questions throughout. And if you do need to stop me at any point, if you're unsure of anything, stop me there and then rather than getting to the end, because you may forget what we was talking about or you may forget questions. You've got a little notepad there, so you can just write down any little questions or anything that you've got that you can ask either at the end or throughout. That's absolutely fine.
No problem.
That sound all right? Ready to rumble? Yeah? Fabulous.
Let's go for it.
Okay, so this is my Picasso drawing of
Wonderful, self-portrait.
Yeah, that's it, self-portrait. So, here we have a standard face. So, basically, the area that we're going to be discussing and talking about today is called the glabellar region. So, this is this region here, which is causing us to frown. So, basically, the glabellar region is built up of 3 muscles. The first one is your procerus muscle, which is a really strong muscle that sits just between the eyebrows. Now, muscle direction and muscle pull are either depressor or elevator muscles. So, depressor, depressing, it's going down. Elevator is going upwards. So this glabellar region is a depressor muscle. So it's a downwards pull onto the eyebrows, which is causing those frown lines. The pull down, is what's causing these lines to occur here. Botox does the opposite of what direction the muscle is moving. So if the muscle's pulling downwards, Botox will relax it up. Right. So this procerus muscle here is responsible for the upwards relaxation of that muscle. Then you get the corrugator muscles, which are the like little tails that come off, similar to an eyebrow shape, really. And they're just each side above each side of the procerus above the eyebrow. Now they do go quite thinner towards the end here. This area this procerus muscle is very deep, and these corrugator muscles are quite deep, but the end of the corrugator muscle is quite superficial. Okay. So we'll come to that later about our injection techniques and how deep we need to inject and everything. But for the purpose of marking up, these are the areas that we need to look at. So, behind the glabellar region, behind these corrugator muscles, is our forehead muscle called our frontalis, which is basically all the way, including the sides here. So it's really important that when we're marking up and we're injecting the glabellar area, that we don't miss the tail of this corrugator muscle, because what will happen, we'll inject too deep into the frontalis muscle, which could cause an eyebrow or an eyelid drop, which is what we don't want. So the best way to be able to avoid missing the tip of this corrugator muscle will be to draw on some safety margins. So safety margins are really important to make sure we're targeting the muscle that we do want and not the muscle we don't want. It's quite straightforward in terms of marking up for the glabella. So you've got your mid-pupil here. So when you're marking up, you need to get your client to look directly straight ahead of them, whether that be looking at you or if they lay down looking directly at the ceiling, not left or right, because that's when you know you're going to get the accurate pupil line.
Would it make any difference if they're wearing glasses? Because sometimes glasses can make your eyes go in and out.
Yeah, possibly. Yeah, so if that was the case and if it was, you know, phasing your judgment at all, potentially just take the glasses off, ask the client to take the glasses off just for the purpose of the marking up. If they feel more comfortable with them on for the treatment, then that's absolutely fine.
Fine.
So we're going to draw an imaginary line here. So we're not actually going to draw on the patient's eyelid or eyebrow, but if you could just imagine a line going straight up through the eyebrow.
Yeah.
Starting from here, we're going to go 2 centimetres above the eyebrow. Obviously, it's a lot of much bigger scale at the minute, but 2 centimetres above.
Is that the maximum you can go is 2 centimetres?
It's the minimum that we'd like to go in terms of any lower. Again, we may end up. It's 2 centimetres up for when we're treating the frontalis.
Right.
So it's not necessarily that important at the moment for the glabella, but when we do come to mark up for the frontalis muscle, the 2 centimetres will be important then, and we'll go through that a little bit later.
Right, no worries.
So again, imaginary line here going into your 2 centimetre line there. So now, as you can see, you've got your safety margins there. So providing we stay inside of those safety margins, we're not going to miss the tail of the corrugator muscle. We're going to make sure that if we're injecting here or here, we're definitely going to be targeting that corrugator muscle, and we're not going to enter any sort of no man's land around there. Yeah? So markings up. So when you mark up, when you're injecting your Botox, you get a 1 centimetre diameter spread. So that means wherever you inject your Botox, it will spread 1 centimetre around that area. So we just need to be
in a circle, right?
Yeah, sort of in a circle. Yeah. So wherever you inject, it'll spread 1 centimetre around that area that we've injected. So it's just something to consider in terms of how wide your spacing is on your markings. Yeah. So with the precarious muscle, we're going to go deep at a 90-degree angle for this. And we're just going to go pretty much directly into the middle of that muscle, just above the eyebrows and in the centre of the eyebrows. That's usually where your precarious is located. And sometimes
imaginary line between your eyebrows, in the middle of that, and then just
absolutely, just in the middle of the eyebrow region. Sometimes it's beneficial to get your clients to frown, and you can actually see the precarious muscle. I would show you, but I've had Botox myself, so I won't be able to. But yeah, so precarious muscle marking. And then we're going to go to as far to the end as we can for the corrugator, but making sure that we're well within medially towards those safety markings. So about there, and then again about there.
Yeah.
Now, obviously this is a wider scale face than we would do on an actual human face. Yeah. But let's just say, for example, this is usually on a normal standard size face. This is probably about 2 centimetres apart. Right. So we just need to fill in the area in the middle with another marking to make sure that we've targeted that full corrugator muscle.
Right.
So this is now usually your standardised units. If the patient is, for example, male, or if they've got a really wide set face, you may end up putting another 2 markings in the middle rather than 1. If the patient's got a quite small face, you may only want to just do the 3 markings, but on average, as a rule of thumb, we'd probably do 5.
And that's because you got this 1 millimetre, 1 centimetre, 1 centimetre gap. What happens if you overlap the 1 centimetre? Say for example, you have a really narrow face, and the middle one was going to catch on the 2 out. Does that really?
So no,
I mean, I'm not saying full.
It's targeting the muscle that we want. Anything that's if we're overlapping in the frontalis, you can cause a bit of a drop or a heavy feeling on the brow. But for this region, providing we're injecting into the muscle that we want, we're just going to get that bit more of a lift, which won't be too hazardous to the patient. Okay. So, have you got any questions from there? Yeah.
The only thing I just thought about then, if I inject 2 weeks and it's still 2 weeks and it's still got movement, what do you do then?
Right, so you do the exact same. So what you do in terms of your safety margins, you do the exact same, making sure we're staying within the mid-pupillary line. And then you probably would just get the patient to frown. So frown, see where the muscle's moving. If it's got a little bit of a pull from the outer corrugator muscle here, then we maybe put a little couple of units each side there. If there's more of a downwards pull towards the centre, it may be the precarious that we need to treat a little bit more.
Right. If you were to do that, if it did have movement, could you go in the same place, virtually the same place? Would it make any difference?
Yeah, absolutely, because what we're doing is we're wherever we've treated, it hasn't treated fully to the extent that we want it to, so putting a little bit more in will help.
It won't cause any other damage or problems,
No, it shouldn't do.
That's fine, fine. Yeah.
Perfect. Right, shall we have a little demo on yourself?
With my girlfriend here.
Yeah. Right, so I've just drawn on where would be the mid-pupillary line for you.
Yeah.
And I've also drawn the eyebrows on. So looking at it, first of all, where do you think is a good starting point to do? Would you say,
I'd say about...
Perfect.
About there.
Brilliant, yeah, that's
and
it.
On the other side, I'd say...
Perfect.
There.
Yeah, fantastic. Okay, perfect. So now looking again at our 5 markings that we've got, good starting point is always, I think, to be in the middle, and then whatever you do to the left, you do to the right to make sure that it's symmetrical.
Yeah.
So starting off with the precarious muscle, where would you say is the best option for that?
Line across there.
Yeah.
So imaginary, I'd say there.
Brilliant. Perfect.
Yeah.
So then now we're going to want to target towards the tail of the corrugator.
Yeah. Always go to the outside and then work your way in.
I'd say so, yeah. And it's just so that you can kind of judge whereabouts you need this middle point, so that it's in the middle of the outer and the middle.
So we're looking probably 10 milli. I'm used to working in millimetres.
Yeah, no, you're fine, don't worry.
Or centimetre centre from there, which is probably roughly there.
Perfect, yeah, and then symmetrical on the other side.
There. And then what you're saying is,
and then just kind of meet it in the middle.
Equal. Obviously, I mean, it's a bit rough. That.
Yeah, of course, that's it.
Does it matter if it's not?
If there's a couple of millimetres out either side, it's not detrimental. Yeah, you just want to try and get it as symmetrical as you can. Yeah.
So then what I do then is put another one in there.
Yeah, brilliant.
And then one in there.
Fabulous.
Would it make any difference if I start the centre one and I did that one, then that one, and on my third one, the second one, I went that way to that way? Or do you always work from left to right?
Yeah, no, so all this is just making sure that whatever markings you've got on the left-hand side of the face, you've also got on the right-hand side of the face. So this isn't our actual injections, this is just the marking up. So once we've got the marking up, you can, providing it's a way that you're going to remember what area you've injected, you could potentially inject 1, 2, 3, 4, 5 and go in a line across, making sure that you've targeted each of those markings that you've got.
Well, the only thing I was thinking about is it's not time dependent.
No, not necessarily. No. So once it's in, within a couple of minutes, it'll only take 5-10 minutes to inject. So it'll also start working overall then.
Yep, smashing that. Yeah.
Fabulous.
Yeah.
Real? Does that seem all right? Pretty straightforward.
Fine. Yeah.
Oh, brilliant. Well, I can see there you've got really clear markings. You've identified your safety margins really well. You've not made sure that your outer corrugator markings, they're not too wide, they're not too far in, and you've got pretty much equal spacing in between each injection point.
Not ideal, but it's
no, you've done
that's
really
why
well.
I was asking why did it make a difference if they do overlap slightly? Provided they don't overlap.
Yeah,
well, obviously you don't have an injection on top of an injection.
Yeah, of course, and obviously our markings are quite big there anyway. Whereas the tiny needles, you're going to get that overall diameter spread, which would be great.
Right.
Fab. So, well done. You've passed with flying colours for that part of the assessment.
Thank you.
Just one more thing now, and it's just your little exam. So it's a really laid back exam.
Yeah.
If you're unsure of anything, don't worry about it. If you do get a question wrong, don't worry about it. We can go through it, give you some feedback at the end, address any sort of areas of weakness or any strengths that you might have, and we can have a little bit of a chat about it afterwards. Does that sound all right?
Yep.
Perfect. There we are.
Thank you. You want me to